Hey, what is going on? Dr. Delon Canterbury here, CEO and founder of GeriatRx. Welcome to our live series where we talk about if you want to choose the red pill or the blue pill. And so, if you haven't met me, I am a board certified geriatric pharmacist and founder of GeriatRx. And so, I honestly got on this journey to talk more about deprescribing, talk about how we can better advocate for our patients from a place of darkness. I used to be a retail pharmacy manager with Walgreens for the last 6 years after finishing up from UNC Pharmacy School in 2014. And so, of course, I did not have any residency, so I landed the job I had first, which was working as a floater with Walgreens. And, I actually had a blast driving around North Carolina, learning the system, but really it showed me so much was missing when it comes to our patients' care. And a lot of mistakes can fall through the cracks of our healthcare system. But it taught me so much on how to talk through barriers in care, how to discuss action plans with providers, with nursing providers, with caregivers, with the patients themselves. And truthfully, it led to an eventual burnout. I got so frustrated with the day in, day out of going to work, not feeling like I'm truly helping people, just feeling like another cog in the wheel, just literally being a problem myself as I would go in, clock out, and just be a robot for 8 to 10 hours straight. And to be frank, I got super depressed. I got super anxious, super depressed, and I did not know if there was a way out. I literally felt like a passenger in my own life. I mean, you can ask my text back then, but the truth is, I just wasn't the full Delon that I felt I was now after stepping down and starting my own company, GeriatRx. So, why are you here today? Why do I want you to take the red pill? For the next couple of days, we'll be talking more about the DPrescribing Accelerator that we're going to launch next February. We're going to literally teach senior care providers, clinicians, caregivers, training advocates, as well as nursing home directors. We're trying to teach everyone who's in the senior care facing space on how they can implement, stop, and spot over-medicating in our most vulnerable populations, our seniors. So what got me here today? I told you about my experiences working in the retail setting for 6, 7 years, getting burned out, feeling like I wasn't really a pharmacist, just a glorified cashier. And truthfully, my anger with the health system started long before I even got my pharmacy degree. Unfortunately, we have nearly 275,000 people that die each year due to the lack of having appropriately managed medications. I mean, that's a shame. This is supposed to be America. I thought this was supposed to be amazing in terms of our healthcare system. But this equates to nearly $500 billion that we, the taxpayers, waste due to the hospital visits, the absenteeism, the actual cost that we lose from just having them repeatedly go back and back to the hospital, or unfortunately just dying. And that's a shame, right? Like, there's no need for this to be such an ongoing, growing problem. And the truth is, we know that people are over medicated. We know it. We feel it. If it's a loved one, it's like one of your first instincts. Is it really the med? But people feel helpless. They don't feel like they really have a voice when it comes to this or how to really address it. But the worst part was my grandmother was one of those statistics. She, before I actually finished up pharmacy school, she was in a nursing home. And unfortunately, her dementia spiraled out of control after the inappropriate and harmful prescribing of an antipsychotic medication. My parents did not know where this came from, why she was worsening, But the worst part was she was kicked out of the nursing home that prescribed the medication to begin with due to having behavioral issues. So it's a little odd that, in retrospect, we're able to identify after 4 months of my parents being caregivers, stressed to their nerves and working full time, that it was actually the medication she was written that led to her symptoms worsening and her dementia spiraling out of control. And now, I wasn't a pharmacist yet to fully advocate. However, I was finishing up college and applying to pharmacy school, and to finally learn that it took literally a retail pharmacist, which I eventually became, to catch the error after 4 months of just paying for caregivers, paying for at-home care, billing Medicare ridiculously for things that we really could have had prevented all along, was because of one pill. One pill. So think about that. And that's something that never, ever left my mind when it came to my grandmother, Mildred. And luckily, if it wasn't for that pharmacist, she was able to see the year of 90 on her last day, where she eventually died a month shortly after my last day of pharmacy school. So this is deeper than just me. The problem is when I go work, I started GeriatRx, I help people look for the ways to deprescribe and get off these meds. And don't get me wrong, I have my own setbacks and pitfalls too, and how I would determine how to best approach this with the provider, or how to best explain how to create an action deprescribing plan with my patients. It wasn't always easy at first, but I'll tell you what, I got angry at just seeing another patient, in fact, my very first patient with GeriatRx, who reminded me so much of my own grandma. This was a 70-year-old woman. She was on, this is how you know you're in the matrix. She was on 36 medications, okay? I'm gonna say that again, 36. She was on 36 medications, right? It didn't make any type of sense, any type of sense. And the worst part was she's been on them for a while before she came to me. And it really didn't occur to the family that it was the medications, except for one person, and that was the daughter of the parent, who decided to reach out to me and hire GeriatRx to do a medication review. So I'm looking at this case like, what on earth? Like 36, bro? Like, is this real? I mean, how did this even happen? And we found out eventually that she was in and out of nursing homes 2 times in the last 2 years. And so a lot of the meds that were written in the homes were kept on and renewed without question, right? And so she ended up going home and just staying on the same meds. And unfortunately, this woman was irritable. She had dementia, just like my grandmother had. She was constipated to days end, like weeks on end. She was frustrated. She was literally characterized as a walking zombie, okay? So imagine your grandma just drooling in your room at home, and you're here trying to figure out, does she really need to be taking 36 medications? And the answer is, of course not. That's usually problematic if I hear such a ridiculous number. So we were able to show that she was being overprescribed. She was being overmedicated. And the beauty of having your own personal pharmacist makes it a little bit easier to address this issue and create an action plan with the caregiver, with the patient, and with the provider, so you can give that true holistic team-based care that our healthcare system desperately needs. We all know that it's broken. We all know that one doctor may not talk to another. The pharmacy may not talk to the caregiver may not know what the new prescription is, and it's a jumbled mess. And seeing that day after day in the retail setting, it led to me just breaking my heart. So the biggest barrier to deprescribing starts with, guess what? Education, right? Like, you don't have to be a pharmacist to educate someone on signs of being over-medicated. Of course, it's ideal, but what I'm learning when I go to these nursing homes, when I give my presentations at conferences for caregivers, when I'm discussing plans with wellness directors, they actually know the signs. People see the signs. If you got someone falling left and right more than usual, if you got someone just zonked out, zombied out, if you got someone who's in unusual amounts of pain consistently, if you're seeing confusion, dehydration, or just even mood swings, there are some pretty strong telltale signs. And most patients who have a caregiver or a loved one looking after them, they're going to notice a pretty substantial difference in how they're feeling and how they're acting. So, of course, you want a pharmacist to, one, work at the top of their license, two, be able to identify quickly which drugs may be problematic when it comes to our senior patients. But ultimately, it comes down to the patient just knowing, or the caregiver. And so what I'm seeing is you guys know it, but you don't feel like you have enough confidence or enough know-how or really the expertise to help you get your loved one off of that med. And so here comes GeriatRx. Here comes the DPrescribing Accelerator. I'm finding that it helps to be a pharmacist, but truthfully, there are ways we can teach different types of community outpatient settings to use that pharmacist's brain without having the pharmacist necessarily there. And no, we're not telling people to just stop a medication because you have XYZ. This is completely part of a holistic team-based care plan where we work with providers and the patient's family to see what shared decision-making do they want to make to get them off of meds safely, not just stop abruptly. I'm never going to endorse that, okay? So the biggest challenge I found and what I had to overcome was the communication piece to patients, to having a cohesive and coherent plan when it comes to working with doctors and streamlining the shared goals that we all had as a team. But most importantly, again, it comes down to educating. And so we have tons of touch points in the community for caregivers and patient advocates, but they don't exactly know all the tips and tricks when it comes to what meds are problematic in our geriatric population. So why not make it easy for you? Why not give you the tips and tricks that you can spot some of those signs of overmedicating without having a pharmacist for every single patient? Of course, that's ideal. I want more pharmacists to be integrated into our healthcare system so that one, patients see the value, two, providers see the value, and three, our healthcare system benefits overall because we probably saved a life or two from our intervention. It's not as hard as you think. You don't have to be a clinician to become a DPrescribing advocate. The proof is in the pudding. My very first patient just had a feeling that her mom was on too many meds. Trust your gut. That could easily be a sign of being over-medicated, especially if you're on 36 medications. Like what matrix are we in, right? So I learned a lot about some of these challenges and a lot of these barriers when it came to addressing these cases. And when it came to the pattern of just seeing repeated issues from nursing home to other caregiver conferences, and it's the same stuff I'm hearing. The providers and clinicians may not talk to each other. The pharmacy got a rejection and they didn't know how to do anything about it, so they just let it sit there. And it's a bigger problem. And I'm not putting the blame on any one person, but the issue and truth of the matter is our healthcare system's broken, especially if you're a geriatric patient, especially if you're a minority patient of any kind or sort, and especially if you don't have the means to even afford your meds or access to care. And there's so many just intricacies that come that lead to better patient outcomes. And that's why now you're hearing so much about social determinants of health. And it's extremely important. But pharmacists can do so much more than just filling prescriptions and counting by fives. And so that was why I felt I had to not only start GeriatRx, but lead you to consider our DPrescribing Accelerator. We are one of the best patient advocates you can truly have out there. Just hands down, no arguments about that. Not only are we one of the most accessible providers in the community, but we are the caregiver's BFF. Like, we're just your friends for life, right? We know how to make meds cheaper. We know how to look for alternative solutions. We make life easier for the doctors and save them time and money on the back end. And we build that confidence and trust to really have that full holistic approach to care that is sorely needed. We all have value in how to help people and how to help our patients. But I want to encourage you to not stick to the blue pill. I want you to look at yourself and see how have you helped someone talk about over medications or over prescribing in one of your senior patients. Have you felt something in your spirit just say, I think something's off with the diabetes drugs, but I just don't know what to do? Like, would it be nice to have a pharmacist in your back pocket to just give that extra glance and say, you know what, you're right, let's look into this? Wouldn't you want your own tools yourself to build a easy to follow step-by-step platform to help your provider and patient get the best out of their healthcare? I would, and that's what I don't want patients to miss out on. And that is why pharmacists, as well as senior care providers, can put the power in their own hands and break through this broken system. We talked about a couple signs and side effects, but I'll break it down to three. You want to talk about one, what type of health conditions are out there so that we know what to look for when it comes to patients who may be, I don't know, having falls issues or maybe having dementia and you're not sure how to handle certain over-the-counter medications. It's more than just simply saying you have this, so that means it must be this drug. It's a little more complex than that. However, having an idea of what to look out for is going to empower your patients and empower your providers so that we have the red flags up and you're able to act and hopefully improve their care. Lastly, how many meds that are on? I mean, hopefully not 36, but if it's more than 5, we want to start talking about, one, are they really taking all of them as written? Two, are they all appropriate? Does each drug have an actual need or indication? And are there any ways we could maybe combine one or two together? You can ask these questions to your provider today, and you could potentially get your loved one off of 1 or 2 pills. There's also just talking about any side effects. Of course, when you get older, you're going to have some stuff just change. Our bodies change, right? But don't assume every little change in your body is just normal. Ask questions. Learn and ask if you're having problems sleeping, if you have a change in energy, if you're having mood swings for your loved one, if you're seeing noticeable differences. Talk to your local community pharmacist about that. Talk to your provider about that. Probe and ask. Don't assume everything that you're on needs to be a life sentence of taking that prescription. So again, this is Dr. DeLon Canterbury. I started this DPrescribing Accelerator to show you and show people who are facing senior patients who just feel lost and confused on how to advocate and how to deprescribe harmful medications in this subset of patients. So hopefully today was helpful. We talked about how you can spot some basic signs of over-medicating in senior patients. We talked a lot about falls risk. We talked about mood swings, pain, confusion. There's a lot more to cover, so stay tuned. Thank you for joining in tonight with the red pill versus the blue pill. I hope you choose the red pill, and let's break through this together and learn how to put DPrescribing into the power of our patients. All right, Dr. DeLon from GeriatRx, you guys take care. Have an amazing week, and tune in tomorrow, 7:30 p.m. Eastern. We'll be prepared to tell you some more ways that you can put the power of DPrescribing into your practice today. All right, have a good night.